really there is like I feel it's like an urgency that we need to support each other and bring more healing, and it doesn't belong to any one person. So I think that there is so many people who need help and support, and so I think that's where I think the collaboration and sharing is important, because a lot of times the opposite comes from fear and sense of scarcity and the desire for power, money, control.
All right. Veronika Gold, welcome to the Smarter Not Harder podcast. Thanks for joining us today.
Thank you. Excited to be here.
So, I've come to know you over the years, actually, just meeting in person for the first time, only recently at Trikuna's event. But I want to give everybody a sense of just your background here for a moment and how you got in this space, right? Uh, Many people listening to this are going to be familiar with the name Stanislav Grof, and you've had the pleasure of training underneath him or with him over the years. And I would love to hear a little bit more about that experience and how you came to that moment.
Yeah. So I actually met Stan when I was um, just 16 years old. So it's kind of surprising to me, just kind of thinking about myself as a 16-year-old going to a conference on transpersonal psychology, and met him, and it was very
And you went
inspiring.
to a conference, sorry to interrupt, but you went to a conference on transpersonal psychology at the age of 16.
Yeah, so it was, after the the revolution happened, and there was a change, and kind of I grew up in Czech Republic. So after the communism, there was just so much openness and curiosity. And so this transpersonal conference was in Prague, and my friends told me about it, and we went. And so Sten talk, and then he was offering holotropic breathwork. So I went to holotropic breathwork workshop, and then over the years I had different interactions with Stan. It wasn't that like I wasn't studying under him directly, but I did some of the trainings in holotropic breathwork, and did a lot of workshops, and worked with other psychologists and therapists who were trained by Stan. And he was the reason why I moved to the United States in 2003. He was teaching at California Institute of Integral Studies, so I applied to that school and studied there, and had more interactions with him until he moved back to Europe a few years ago.
And so, when it comes to somebody with where does the interest in in psychology come from? Because you're 16 years old, and I can remember myself as a 16-year-old. All I cared about was like sports and maybe just trying to get a girl to say yes to me on a date. But you're interested in psychology. What made you interested in psychology at that age?
It's a great question. It sometimes just things happen in life that they kind of come together. And, I think there was just that um like restriction of information and knowledge and books that were not available in communism. And then after the revolution, didn't have any books at school because a lot of them were just made up. And so there was a lot of excitement, and people were, bringing books and information and reading. And so at that time, Stan came back and he did a holotropic breathwork training for facilitators in Czech Republic, because that was his home country. And I think one of my friends was familiar with LSD, and he talked about LSD psychotherapy and how these medicines were used for healing and transformation. And he found out about holotropic breathwork and Stan Grof, and that's kind of when we found out he was coming, and we went to that conference. And so, there was the interest. And then, um, doing holotropic breath work, it really opened up a lot for me. And so there was, um, processing of a lot of grief that was from, growing up in communism, growing up with, um, just multiple challenges. And so that there was this unprocessed grief that I was holding, and that kind of opened up in the holotropic breath work. And then I was interested in, kind of that concept of psychedelics helping with mental health, and then also saw, the challenges with non, psychedelic drugs, and people who are struggling with misuse of, and addictions. And so I worked or I started volunteering in this center for people who were struggling with non-alcohol, substance misuse. And so that kind of continued to evolve, and deepen my interest in psychology and psychotherapy.
Okay, so you have this center, this exposure to, I guess, would it be fair to describe them as sort of non-alcoholic substance related addictions? And I'd be curious. So you mentioned LSD and psychedelics and sort of the background, and Stanislav Grof, of course, has those two, holotropic breathwork and LSD, connected. But where did because you built out this wide knowledge of both the indigenous plants and some of the other molecules. And so, how did you start building that knowledge? Because it's for somebody listening to this, like a lot of what's available are just online trip reports or whatever. Like, where were the kind of sources that you turned to start building this knowledge in this field?
So it was sharing of friends, colleagues. So at that time, when the borders opened, a lot of my older colleagues would go to Amazon, would sit with ayahuasca, would be coming back, and sharing about their experiences, um, and reading books. And really the interest, I was involved a lot with the holotropic breathwork, and with this center that was for personal growth and transformation, and there were teaching a lot of shamanic practices, which were non-medicine related, but worked with these states. And then so my interest continued. And so I was, meeting different people, different teachers over the years. And um, also, then when I moved to United States, I met a Peruvian healer, Tito La Rosa, who did a lot of ceremonies with sound journey, sound ceremonies. And so got quite familiar with that culture. But it wasn't until, 2016, when I was able to start working with these medicines. I became a psychotherapist, psychologist, and then psychotherapist, and I was working with, um, people who had experiences of holotropic breathwork, or who worked with other psychedelic medicines. Um, and I applied to work with MAPS as a therapist. I think I applied in 2009, and then was accepted to be therapist in 2016. So there just has been like a years of, finding different connections, and sharing.
And so, what do we know about these various substances? And we can feel free to go down. You mentioned, some of your colleagues going to ayahuasca, into the jungle, and sitting ceremony there. What's exactly known about these substances? Because I don't, for anybody listening to this, what we don't want to make is the assumption that, like, hey, you're listening to this and you're all of a sudden a psychonaut, right? Like, we want to make sure that people are comfortable with this conversation, because there's a lot, particularly in the United States, but everywhere, a lot of dogma around psychedelics, and sort of how what the Nixon administration essentially did. Um, and I remember being a child of Dare, right? So I would go to school and have the Dare officers come and tell me that drugs are evil, and to a certain extent that they are right for younger people, but um, what do we know? about these substances, and maybe we can go through a few of these and just demonstrate their efficacy and safety.
So there is a huge impact of the war on drugs and these information. I didn't grow up with that, but I since I've left Czech Republic, seen these commercials of the fried eggs, and this is your brain on drugs.
Oh, that's the one I remember specifically all the time.
So it's terrifying. A lot of people who um, come to working with me, and we'll talk about it later. I work with ketamine. There there are a lot of fears that are still kind of going back to the war on drugs, and so there is I feel like that what has been called like psychedelic revolution, or this new wave of information where we are really getting more accurate information about these substances. And I think about them as tools to access this expanded state of consciousness. We can say non-ordinary state of consciousness. In the past, a lot of times people will say altered states of consciousness. So that is something that helps to kind of expand the normal way of perceiving reality, the normal way how our brain works. So that we are kind of moving out of this default mode network, um, and so people have greater access to their own inner world as well as um, external world. Stanislav Grof talked about the cartography of the mind, which is a way of describing these different levels of consciousness that we can start accessing with these non-ordinary states. And that, as I mentioned, they could be through holotropic breathwork or shamanic practices, but also through the use of these psychedelic medicines, and that there are um, different, like many different plants, different manufactured psychedelics
I
that.
certainly didn't give you an easy question. We can go down. Why don't we pick one and just sort of focus on that first? And you can choose whatever one you want.
Yeah, so like maybe talking about ketamine is one that is legally available. So in a way that is what is most accessible to people in the United States and around the world. And um and it is interesting medicine. It's called associative anesthetic. That's how it's classified. And it was originally approved for anesthesia, and it's used for anesthesia widely. So we have a lot of experience with ketamine. It having a safety profile, but as they were developing it, they found is what they call the emergence phenomena, which is as people were coming out of the anesthesia, they would share these experiences they've had, which would be these experiences of um, uh, these other states of consciousness. And it could be from person having experience of their own birth, to remembering parts of trauma that they didn't remember before, to more transpersonal experiences like um, archetypal experiences, or uh, experiences that were maybe of their parents or their ancestors, but they were able to access them through this medicine. And so that became an interest for psychologists and psychiatrists, and started studying ketamine for use in mental health treatment. And so now we can work with ketamine in these different um, paradigm. So there is the medical paradigm, where we're looking at it as a the neurobiochemical action of ketamine. But then we have the psychological paradigm, where the substance is used to lubricate the psychotherapeutic process. So it allows to deepen the therapy that is already the client is engaged in. And it also can be used in the transpersonal paradigm, where we believe that going to these deeper expanded states is crucial for the healing and transformation. And so there, the ketamine is it becomes similar to some of the more classic psychedelics. So that when we think about mushrooms or LSD, where there are a lot of visions and internal vision and internal journeys that kind of can be similar in that transpersonal paradigm.
Ketamine is a particularly interesting one to go down, and uh, I guess for somebody who's coming to this, perhaps we'll start with the negative and move to the positive. And they're listening to this conversation and they're kind of wondering, is this for me or is this not for me? Is there any particular population where we can definitively say, like, hey, you probably shouldn't use these medicines now, and we'll focus specifically on ketamine. You probably shouldn't use ketamine now, but maybe later. Are there particular types of conditions or people that should probably avoid these types of things?
Yeah, yeah, and so exactly as you're saying, there is contraindications for all of these medicines, and that while they can be very helpful, and I am advocate for doing it with a provider, with a guide, with a therapist who can provide support during that experience. There are contraindications for all of them, and this ketamine and other medicines. Uh, Somebody who has history of psychosis, or for example has bipolar depression, and is in a hypomanic or manic state, and or have bipolar depression but are not on stabilizing medications. Um, so there are some of these psychological contraindications. Uh, People who have history of psychotic disorders, schizophrenia, if they have that history in their family, it's not exclusion, but it's an orange flag to be mindful of it. And then there are medical contraindications. So usually, if you're looking at heart, kidney, liver issues. But ketamine is actually one of the psychedelics that has less contraindications than some of the other medicines.
hmm So, for instance, the other ones I'm guessing you're referring to, like people on SSRIs probably shouldn't use, keep going, like LSD, for example. Um, so then we went negative. Now we'll go positive. Uh, there's a whole population that really needs to be educated as to like why they might want to seek out ketamine. And there's a few researchers out there talking about treatment resistant depression, but what other reasons might somebody want to explore ketamine therapy?
So we have now a lot of research, on depression, but also anxiety, post traumatic stress disorder. Um, there's research being done on addictions and eating disorders, and I think we have to bring in the paradigms of treatment. And so there is a medical paradigm where we have a lot of these studies which kind of show us the symptom reduction after the treatment. But then in the psychological paradigm, it really can help people to get kind of unstuck from where in the therapy where they have been. It allows them kind of a spaciousness from um, their patterns, their life, the way they're feeling, and kind of have this maybe like a bird's eye view on their life and their experiences, so they can start uh, changing the relationship to themselves and to the challenges they have in their life. A lot of people are coming who are struggling with self-acceptance, self-love, um, struggling with negative beliefs, um, ways they're stuck in relationships. So I think these ways that we would traditionally think about going to psychotherapy can um, be supported by working with ketamine. And I also think um, it can be really helpful for self discovery and um, kind of optimizing one's life and personal development. And that's, we don't have a lot of studies on that, because that's, mm,
Quite
we.
hard to do studies on optimization, or get funding for it at least. So,
Mm-hmm.
I want to explore more of because you brought up talk therapy, right? And I think, and for my own self, have used talk therapy before, but have found the combinations of, and we'll focus this on ketamine because I have used ketamine in the past. Using ketamine in conjunction with therapy to have this multiplier effect in a sense of effectiveness of what I was after, which was along the lines of that self discovery component, self love. But uh, uh, what about the talk therapy, or the combination of therapy plus the medicine makes it so effective? Why is that? And why? Because you see a lot of these, sorry, going on a rant here for a second. You see a lot of particularly like in my own town, you see these ketamine clinics where you go, you get your IV and then you leave, right? Um, is there benefit to that? And maybe on top of that, why does the therapy add so much more value?
Mm-hmm. Yeah. So, we know from just research that any type of medication, when you add psychotherapy, it is more beneficial. So we know it in other psychiatric medications like SSRI or anti-anxiety, medications. And so that's kind of the shift in that paradigm, because when you're looking at a medication, you're looking at uh, symptom reduction, and that's oftentimes very immediate. So they might do the infusion, or they might get the ketamine treatment, and measure their symptoms just, maybe right after or a week or two after. And then it's something that people oftentimes have to take repeatedly. And so when we're bringing psychotherapy, we are actually looking for resolving the underlying issues. We are looking for um, kind of bringing this personal self discovery. And I think about therapy as this longer term treatment, where the psychedelic medicine is more of a shorter term intervention. And it might be with ketamine that, a lot of times people come to treatment, and they're in psychotherapy, but then they do like a series of more intensive sessions with ketamine, and they do as needed, or, kind of like spacing out the sessions more. But at the same time, their process is held with the therapist over that period. So, as well as they're coming for sessions more frequently, like once or twice a week, and then maybe they're coming once a month, but they're still engaging in psychotherapy every week. And the therapist also helps with the integration, with kind of looking at the material that emerged in the sessions, and helps the client to stay kind of accountable to the changes they want to make in their life, or to support, the unfolding process. I think that there is like these two sides, that, sometimes there can be really beautiful experiences, and we can heal and change through these positive experiences, and sometimes they're challenging experiences, and it's really helpful to have someone who understands the terrain, that can be a guide and help clients to maybe change that challenging, or they could call negative experience, into something that actually was really worth it and really important, because that's kind of where the gold nuggets kind of came from.
Yeah.
Yeah, yeah. And I think, there is different types of talk therapy. So it's also, I think there's some that are more compatible with psychedelic medicine than others. Um,
Can you give an example there? I'm curious.
yeah, yeah. So I think like a relational therapy, which is um, um, focused on the relationship and kind of seeing the patterns that are emerging, is really compatible. Then somatic therapies. So, working with either with touch, but also with just somatic awareness, I think is key or crucial when we work with psychedelics, because a lot of the experience is not processed through one's brain. It's kind of in the body, in the heart. So the medicine kind of brings the person out of their mind, and their like the process, the healing can happen through the experience itself. When we kind of Bessel van der Kolk's book Body Keeps the Score really points us to, there's a lot that's stored in the body. So somatic therapies like Hakome, somatic experiencing, sensory motor therapy, and other touch methods can be really supportive. Therapies like ACT, um, internal family systems have been helpful. I think less helpful might be something like prolonged exposure or cognitive behavioral therapy, which are much more structured therapies that are helpful and people benefit from them. But it's almost like a little bit opposite to what happens in psychedelic sessions, where we are kind of allowing the process to unfold and are not bringing so much structure like you might find in some of these other therapies.
And so one thing you hinted at there that I with the book The Body Keeps the Score and others is this idea of hidden I guess let me phrase it as a question. When a client comes to you, how many times do you eventually arrive at, the underlying issue being far different from what was the initial concern, right? And so somebody shows up at your door and says, "Hey, I'm stressed. I want to get rid of my anxiety." And, what does that discovery, and this is one of the things I've found fascinating about these medicines, particularly ketamine, how many times does that sort of unveil itself in the experience rather than having to talk through it for years and years and years?
Yeah, absolutely, absolutely. That there is, and sometimes it's what the person thinks they're coming for, and what the kind of root cause is, and sometimes it's really different, and it's part of this self discovery that um, happens through the process. And the principle here is the concept of this is being discussed, and there are different names, but is this innate capacity to heal, or this inner healing intelligence, or this wisdom that we all carry, that the medicine session creates this optimal optimal conditions for the healing to happen. And so when I'm working with a client, I'm stepping out of the role of the expert, where I might have some idea like what a healing looks like, or what are the things we need to process, like I'm an EMDR therapist as well, where we, create these kind of plans, what we're going to process and target. And here in these medicine sessions, we kind of allow what wants to come up. And that kind of leads to these new understandings, new explorations, that might be that there are experiences that the person knows, but did not realize how they were connected to the struggle they're having today. There are memories that they have not remembered, and sometimes it comes from transgenerational or collective trauma, and so being able to access and process that um, can become very meaningful, and then changing the symptoms or the challenges the person is struggling with.
Hmm. Oh, one thing you mentioned there was set and setting, right? And as part of the therapy experience, you're taking a molecule, and actually, maybe Veronica, if you can take us through just sort of a therapy experience, because you mentioned set and setting, and I think there's an important thing there about how important where you are, what mind state you're in matters for these resolutions. But do you mind just taking us through what like a typical experience would I typical air quotes, right? What that would look like?
Yeah. Yeah. And so usually the process starts with the intake process, that
Mhm.
the person goes through the intake and then goes through preparation sessions where we one part is getting information about the client, their resources, their ways of supporting themselves, how they will be able to process, with our help or with their therapist's help, when difficult things come up, and teaching them about the principles of this work. And I think about it also that it's like a disruptive treatment. These states are inviting change to happen. And so oftentimes there can be even increase of symptoms before there is a symptom reduction, because maybe there is a memory of some childhood incident that the person didn't remember, and now when it comes back, they're are processing the pain of that, and so that they might feel worse before they feel better. And and then we arrive at a place where I feel the client is ready, the client feels they're ready for the medicine session. And the setting that we work in is very comfortable, therapy office like setting, even though this is a medical treatment, so that there are medical providers, but the office is set in very comfortable way. People are lying down, so we have bedding set up, and there is an invitation for internal focus, so people wear eye shades, and then there is music that plays in the room. And so all of that is kind of facilitating this vulnerability, but also ease. And the eye shades kind of invite a person to stay with their process instead of kind of engaging with the outside. And when the session happens, the person comes in. I think about that I'm also preparing for the session. So the client is, preparing maybe with their fasting, they're thinking about their intention, they're avoiding distressing news or conversation with the most challenging person in their life before the session. So they're coming with more peaceful mind. And then I'm doing the same, kind of thinking about my diet, about my um uh, so that I can be fully present and available for the client. I
So you're
prepare,
not having a Big Mac right before one of these things,
it's,
or at all, I hope.
yeah, or even the night before, when then you kind of you feel a little sluggish or not, right there. Um, it's important, I think, for the therapist and the guy to be mindful of that. And, I want to be rested so that I can stay fully present. And so then they come in, and the first part of the session is usually checking in from, how things been since the last time we've seen each other, and what is the intention that they would like to bring in to the medicine session. And I review with them everything we're gonna do. We talk about agreements around, um, they're gonna stay in the session for until they're back from the medicine, and how I'm gonna help them to go to the bathroom, how they're gonna go home from the session, and that there are boundaries around touch. And so we review all of that. And then there is a shift into the medicine space, and I think about it in a it's a ceremony in a way. It's kind of, there might be that just something little comes in the session, that they might have that ketamine antidepressant effect, or they might be more in touch with their process. But also it might be the 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 most life-changing moment in this person's life. And so we I want to hold that with um the utmost kind of respect and care, that we don't know what's going to come out in this session. And so I want the client to feel safe, and that it's a sacred work going to these expanded states. And so we have like a way how we transition into the ceremonial space, which can be, again, it's on the kind of conversation, co-creation with the client. So it could be sound, it could be um, uh, working with aerosols, using smoke, like smudging. I like to bring in cards, like there are a lot of these, like some are tarot, but some are like animal cards, but it brings, kind of this playfulness. so that we are
Mhm.
also like bringing like a playfulness and curiosity, creativity into the
Openness,
session.
right? Yeah.
And then they take the medicine, and we, do some meditation as they're waiting for it to take effect. And then I'm with them for the duration of the session, of the active effect of the medicine. With ketamine, will be somewhere between 45 and 90 minutes, following them, following their process, supporting them. So kind of getting out of the way, but also having kind of this back and forth. And so sometimes we, talk more, sometimes we work with the body, and then as they're coming back, it's kind of a way of the beginning of the integration. That the first is like coming back into the body, reflecting back on the journey, starting to put more words into their experience. But it's still about kind of staying in their heart rather than, making insights or concepts, because then we'll meet for the integration session, the usually the next day or the day after, where we start to make more of the connections.
So let's talk about integration then, because that was beautiful, and I think door to door in terms of from when they come in to when they leave is that's like a 4 or 5 hour process. I'm guessing.
So with the ketamine sessions, we do 3 hour sessions, but they do, preparation probably the day or 2 days before, and then they have the integration after. So some people need 4 hours, and some people kind of feel ready in 2.5 hours. So in average, it's 3 hours, and it's shorter, So like when we worked with MDMA, it would be like 8 hours. So there is also this, something that can be nice for some people. It's a shorter time.
And integration. One of the things that when I talk to somebody who's going through one of these experiences for the first time, it's sort of the warning is don't go right back to your phone, or don't go right back to whatever you're doing. How do you look at integration in terms of both the day of but also following that?
I think the integration starts already in the preparation, so that there is a way of talking about what the client might feel like after, kind of strategizing for how they will and how we will address some of the things that might come up. We are giving them these suggestions, as you said, like don't go to your phone, don't watch a distressing movie, maybe don't watch the news right after the session, don't call, the difficult relative, and see if you can take more time for yourself, because many of us are used to just like go go go, and so like taking the time. So really that change that's kind of initiated through the medicine can have time to kind of unfold and start to stabilize. And and that the medicine, even though they're coming back from it, it still continues working, so that they're still paying attention to their dreams, to, journaling can be really helpful, because sometimes like there is something and then it's kind of fragile memory and goes away. So we talk about these principles, and then I talk with them a lot about integration challenges. And so that it does not prevent those challenges, but, when they come, we can reflect back and be like, okay, so now we are in this difficult place that we talked about it that can come up. So it's kind of normalizing. One of the, I think, most common and difficult for the client as well as the therapist, but uh, important to understand that there is this expansion and then there is a contraction. And so that's kind of the process that happens. And sometimes we can refer to like zig and zag as you're going, up the mountain, or, riding the waves that come. And so that the client can kind of expect that, maybe they're in this state connected to themselves, to love, to more insight, and then there is going to be contraction. And it doesn't mean that it's something wrong, that the treatment is not working. It's kind of, seeing like, can we find the value in the contraction as well as the expansion.
Oh, that's so beautifully said. Because there's moments where you go through the experience and you're like, this is it. I'm done. Great. And then you go back to everyday life, and all of a sudden you're like, oh, the old me is back again. And just having that mindset of how do I carry that the value into the contraction is very well said. So thank you for that. Let's talk about Polaris a little bit and what you guys are doing there, because I'm fascinated, obviously, with the work that you do. Have asked you questions many, many times, in person, over the phone, etc. Uh, let's talk about Polaris and the work you guys are doing there.
Yeah. So Polaris, it's a small clinic that we have started in San Francisco in 2017, 2018. And the inspiration was my and my colleagues' work on the MDMA-assisted psychotherapy clinical trials for the treatment of PTSD. And uh, also our colleagues work with ketamine. So at that time, there were not a lot of ketamine clinics. There were few therapists who were doing the work, and we had the opportunity to talk with several of them, and um, and and so I worked first at the infusion clinic, kind of bringing in psychotherapy, and then we decided to start Polaris, and it we started providing treatment for clients with individual ketamine assisted psychotherapy. Then we expanded to also offering groups, and um, because at that time it wasn't very known, we started offering these experientials and trainings for psychotherapists. And so it was usually psychotherapists who were in the area who wanted to refer clients to ketamine. It was uh, owners of ketamine IV clinics who've never had ketamine experience themselves and wanted to experience it, or therapists of clients who were coming to us and they were seeing the changes that were happening, and so they became curious. And so that kind of started this kind of education piece. Um, and then the pandemic happened, and we were thinking a lot about how to move forward, and then decided to offer ketamine virtually. And we were offering groups for first responders and nurses, therapists, physicians, and for a lot of people it became really kind of the lifeline in the pandemic to be able to do that. And that led to developing a training program. And so now we have a team of about 8 therapists who provide ketamine-assisted psychotherapy, in person, virtual groups, and then we have a training program for training providers, psychologists, psychotherapists, uh, but nurses, chaplains, ministers. And we started offering training also for spiritual leaders, as we think it's a really important part of the support for people working with psychedelic medicine.
Of course, and healing the healer is certainly a big role as well. Um, Want to transition, Veronica, to just getting, psychedelics. I generally don't like the term renaissance, but I'm going to use it. It's had a little bit of a, a comeback, if you will, over the past, and you've been a part of that since really it started becoming known in the press. What's your biggest concern about this movement with psychedelics at this moment?
It is, I think the medicalization of psychedelics, of not understanding the expanded states and the um, kind of layers of consciousness that we can access, and um, therapists offering these treatments without proper training and without self experience. Uh, because this while it's a I don't like the term either. It was like renaissance, and
Yeah, of
it's a but there is this comeback and new way of relating to these psychedelic medicines, but they've been around for thousands of years, and Indigenous people from all around the world have been working with expanded states of consciousness as a way of healing, growing, transformation, communal healing, uh, transitions, and the self experience in all these cultures is really the key. And sometimes it's years or decades of personal experience before the person becomes the person who carries the medicine, who administers the medicine. And so then in the Western world, we oftentimes approach it as it is a tool that I'm going to put in my toolbox, and not necessarily need my own experience or maybe have one experience, but the people don't really get to know the medicine, the substance, and there are a lot of different challenges that can come from that. So that is, one of my biggest concerns, because it's not only the harm that can be done to the client, but also the harm to the therapist, because the burnout that can happen if the providers are not familiar with this work is quite high.
Yeah, I remember, just as an aside, the story. I haven't shared this with you before, but my wife, one of her best friends, went to a yoga. We were living in Amsterdam at the time. Went to a yoga class, and it was pay what you want ayahuasca ceremony. And she was texting us, being like, "Hey, should I do this?" I was like, "Probably not a good idea," because it was somebody who was trying to basically learn on the fly. uh, those types of things are now popping up, which that I have a concern about. So let's flip it over to the positive uh, here, which is, you see some headlines from even this administration in the United States that there might be a sort of push to move some of these medicines more mainstream. What excites you about the field over the next few years?
The possibility of healing of trauma is such a big one for me. And in the past, we could think about like these big T traumas, and when we go into history, it's not very distant history when trauma wasn't even acknowledged. And so learning about the extent that people have been experiencing trauma, and oftentimes just living in this world, that there is a lot of trauma pain that's being then and transferred to their kids, um and so the potential of being able to heal that and kind of bringing back the the care for oneself, care for the planet, care for the ecology, care for the community. So it's kind of I also see that possibility of the shift from more of that individualized focus to more collective focus, which I think is so important, because if it's not PTSD, it will be anxiety or depression is oftentimes caused by isolation. So there is this way of reconnecting with oneself and with others, um, and so it's exciting to see how many different studies there are, how many different molecules, and that there are different approaches. So I talk about what is my approach and what I believe, but there is no one truth and no one way of doing it. So there is this um multiple approaches, and kind of cross pollination of these different schools, and um bringing the indigenous wisdom, as well as these ways that we are learning. So um, these possibilities are very exciting to me.
One of the things that I've enjoyed most about getting to know you and other people with experience in this community is the openness and willingness to share, right? In terms of, you've shared some of the things that you've learned from various healers, and there's this genuine willingness to share and no expectation of anything coming back. Whereas, we can just look at our world right now. There's a lot of like focus on intellectual property and me holding this very dearly. And it's just been it's been very refreshing actually to just have open conversations over, this works for this type of person. And, I've also had experience here, and, oh, tell me more about that. It's not something you see almost anywhere else. So
Yeah, and I really, appreciate kind of you and thinking about it in this way. And really, there is like I feel it's like an urgency that we need to support each other and bring more healing, and um, that it doesn't belong to any one person. So I think that there is so many people who need help and support, and so I think that's where I think the collaboration and sharing is important, because a lot of times the opposite comes from fear and sense of scarcity and the desire for power, money, control. And when we can shift to this more of a space of abundance and trust and love, ultimately, is we realize that that's not necessary, because there is yeah, so many people who
uh,
need it.
uh, true, very true. And one of my mentors says humans are not the only species of animals on this planet, but we're the most pernicious. And I think these substances kind of allow you to realize that there's more to the world than just humans. I want to shift to three rapid fire questions for just to kind of conclude us, do the dismount, if you will, Veronica, because this has been a fun conversation. I'm sure we're going to have more. Lucky you. But if you were to summarize just benefits of ketamine for people who are tuning in here in a short bit, what would it be?
Mhm. Antidepressant, anti-anxiety, allowing a deeper connection with oneself, bringing more trust in oneself and one's life. Um, so I think those are um, some of the um, benefits.
One question we ask everybody that comes on this show is if you were to give the listeners here one piece of advice to live smarter, not harder, what would it be?
Seems important to um, find a way of connecting back to nature and to listening to oneself, to one's body, because we are taught to ignore ourselves, ignore what is coming up. So um, trusting more, slowing down, more self.
Right. That last part, slowing down, is something I probably need to do sometimes. But Veronica, where can people find out more about you, your work, and what you're doing at Polaris?
So our website, polarisinsight.com, has all the information of our offerings, and happy for anyone who wants to contact me through there.
Beautiful. Veronica, this has been such a fun conversation. I know we're going to have more, but just want to wrap things up today and say thank you for all of the work you're doing in the world. I know numerous people who've worked with you and have all benefited from your work and your teachings. So thank you so much for being here today and chatting with us.
Thank you, Boomer. Such a pleasure to be here, and thank you for all the work you're doing in bringing this information.
Thank you to everybody listening. And for everybody listening, always remember, there is a smarter, not harder approach. Thank you. Have a wonderful day.